Hello. Welcome to Kindly Neurodivergent with Kay. This show is to spend quality time with each other, kindly discussing the similarities and wide range of differences we experience. The experiences we discuss on this show are for educational purposes only. Please do not substitute for professional medical advice, diagnosis, or treatment. Before we begin, I respectfully request that if you witness any pauses during this show, please don't stop watching. I'm composing a spontaneous comment or question. The guest can choose not to say anything while this is occurring. This is natural discourse when an augmentative and alternative communication device user is communicating with a non-augmentative and alternative communication device user. In lieu of Autism Awareness Month, I have a longtime family friend of mine, Melissa Johnson, with me to discuss the balance between behavior, communication, and medication for two nonverbal sons with autism. We have followed each other's families' journeys throughout the years, including, but not limited to, birthday parties, school dances, prom, graduations, Little Britches events and committees, PTA reflection contests, award ceremonies, etc. She gave me my diploma at graduation, and when Chris aged out of school, we all cried at his transitional program party ceremony. Melissa is a wife, mother of 3 adult sons, and currently the president for the nonprofit Little Britches Therapeutic Rising, who has sat on that board for over 25 years. Her 2 oldest, Alex, 29, and Chris, 27, are nonverbal with autism. She continues to advocate for all her sons. Melissa has been on many and SETA boards at a local, state, and national level, in addition to being the chairman for her local board of education for 4 years after sitting on it for many years. Welcome, Melissa.
Thank you. I'm excited.
Please introduce yourself.
Well, as Kayla stated, I'm Melissa Johnson. I have been married for 31 years to my husband, Tom. Our youngest son, he's married, and he's married to the most incredible person. Her name is Ava. It's nice to have a daughter-in-law and our dog. Her name is Winnie. So it helps to balance all the males in our house. But you pretty much said everything I would have said, so thank you.
What are Alex's and Chris' other diagnoses?
So they both do, as you said, they're both nonverbal. Years ago, when they were first diagnosed, it was called like classic autism. Now it's considered levels 3. The other diagnosis that Alex has is OCD, PTSD, which is post-traumatic stress disorder. He has pica, anxiety, ID, which is intellectual disabilities, chronic ear infections, and some stomach problems. Christopher, again, nonverbal. He is considered level 3 also. Anxiety, depression, ID, OCD tendencies, chronic pink eye, severe stomach problems as a child, but not so much anymore.
What is pica?
Pica is a disability that somebody who tends to eat things that are non-edible. It was more prevalent when he was younger. Sometimes people will lick a conveyor belt, like at the grocery store, or they'll eat non-edibles like string, or he used to eat a lot of bark when he was little. Not so much anymore, which we're happy about because it's not good for his stomach. But he had pica, and it was very prevalent for many years. We had to watch like toothpicks and paper clips and things like that when he was younger.
I am Kayla Ireland. I have spastic quadriplegia, cerebral palsy. My other diagnoses include epilepsy, which is a seizure disorder, and dysphagia, a swallowing disorder, along with movement disorders such as spasticity. What is stimming?
What is stemming? So interesting. Stemming is like a self stimulation behavior. An example of like hand flapping, walking on your toes, jumping, head banging. Some kids or some people twirl. A lot of vocalization is considered stemming. So it's very common in the autism community. It can be distracting for certain people.
What stems do the boys have?
So Alex used to be a headbanger. Not so much now. He used to also hold right now he holds his hands. I'm going to show you in a peripheral like this, and he'll watch out of the side of his peripheral vision. He does that quite often as a stem. He's a jumper. He loves to jump up and down. He rocks constantly, like back and forth. And he does vocalize a lot. When he was a little boy, he used to line up VHS videotapes on the floor, all in a line. He did that with Matchbox cars. He did that with Lego pieces. Christopher is our jumper, constantly jumping. He
Mm.
vocalizes. And while he vocalizes, it almost sounds like he's singing. We used to call it opera singing, that because it was that kind of oh type of. And he's a rocker. He rocks all day, every day. So, yep, those are their stems.
Do you know if the boys are mimicking each other?
So this is a funny question to us. We don't usually aren't necessarily mimickers as much as individuals with autism, but Christopher will consider mimicking behaviors that are general. So he can watch somebody do something with their faces and mimic it. So I'm going to show you an example. Like if I went like this, he would do it absolutely the same way, but in a mirror image. So he would do it. If I did with my right, he would do it with his left hand. So he wants to mirror image me. So that's something that he does. He mimics the behavior if somebody closes a drawer or a cabinet, he'll go up and do it again. So that's the kind of mimicking he does. So we kind of refer that as more of his OCD tendencies because it's like he has to do it because somebody else did it, but he's never been diagnosed with OCD. So I think it's more of a habitual thing with him. Um, they both can mimic like self help skills. Again, mirror image. So if you want them to do something on their left side, you're going to do it on your right side. So to answer your question, they don't really mimic each other, but they mimic the people that are around them.
Why isn't it diagnosed?
I think because we've figured it out with his psychiatrist that it's really something that happens with people with autism is they tend to copy people, mimic people, if you, for the lack of a better word. And it's just something he likes to do over and over again, but it doesn't control his existence. Like people with OCD, that tends to control their thought process. It doesn't really control Christopher's thought process. I think he just likes the idea of it. And he likes to copy people. It's just one of his things.
Do you suppress and or redirect any stems?
No, we never suppress stems at all. We don't think that's healthy for them. But on occasion, we need to redirect them, especially if it's in a public situation, mostly loud vocalizations or jumping if they're not appropriate where they are. We might try to guide them or have them do something different.
Was head hanging not appropriate?
Say that again, honey.
Mm,
Head banging, yes, very not appropriate. Is that what you're asking, the head banging?
mm, mm, mm.
What did I do? It was we had to work with his behavioralist, and we had to find the reason it was happening, because it was a harmful thing that he was doing to himself. So we worked through, we did a behavioral analysis of the behavior. We looked at what was happening beforehand, what would happen after, what was his surroundings like, what was going on with him, was there somebody who's putting demands on him, that type of situation. Um, and what we found is it was a communication, and he was saying, "I'm done. I've had it. I can't do this anymore." Sometimes the head banging was actually pain. We didn't know sometimes if he was in pain. So there was an instance where he was banging his head a lot for many months, and we found out he had a horrible ear infection.
What did you replace it with?
We didn't really replace it with anything. It was more of a positive reinforcement. So I guess that was the replacement. We just gave him, well, I guess I'm going to back that up a little bit. When he was younger, what we would do is we would give him something to rub on his chin or his head. We would give him a pillow. He didn't like that. He was like, "This isn't giving me the input that I need." So it was really finding the source of the problem, fixing that versus replacing the actual
Mm.
stem and banging his head. So it was a long process. A lot of emergency room visits from that.
What are other behaviors besides stimming?
So frustration is a big one, and that a lot of times stems from communication and or if they're not feeling good. Anxiety-based outbursts that happens. Some anger issues or outbursts, like I was describing with Alex's head banging when he wasn't feeling good. Self-harming, like biting themselves, hitting themselves, banging head as we talked about, OCD tendencies, repetitive movements, OCD as a diagnosis, yelling, throwing items out the window, ripping up paper. There's quite a few.
Please talk about self-injurious behavior.
Self-injury behaviors. Okay. So Christopher, ever since he was a very little boy, probably around 2, he tends to bite his hand. And it started out at a different place, but it used to be right here between his thumb and his finger, but then it moved to the top right here. So he has a lot of scarring from that. Excuse me. But now it's really hard. It's almost like there's a callus. He did that more when he was younger for a self soothing. So, like, it's a stem, so he was soothing himself. But there are times when he's angry, he will bite his hand when he's trying to communicate. And you've seen that. Yeah. And then while he's doing that, he usually yells at the same time.
How do you determine what is anxiety, stimming, demand avoidance, anger, communication, distress, etc.?
Interesting question because if you asked me this at least 20 years ago, I wouldn't be able to answer it very well. As time goes on and many years of experience helped. But within the family, we know regular occurrences and we have a sort of checklist in our brain that we analyze each occurrence. So we look for levels of medication that's been given, look at the environment around us. The time of year is very important, especially for Alex. What is happening within the home at the time? We take data, we ask them yes or no questions to see if we can get responses from them, which is great because sometimes very little responses are yes and no to our, we can tell by observing them. It usually helps to determine what is happening and why. So this isn't always accurate, but we still try, and we have, 4 to 5 people in our home that we can talk through the occurrences. So that helps.
Are the yes or no accurate?
I will say probably 75% of the time. Sometimes yes or no questions for either one of the boys, they're going to answer immediately whatever the first one is. So you come sometimes have to switch it up, right? So, but you kind of know by their body language. If they're saying yes or no, you can kind of tell. Again, we live with them, so we know kind of how they're always feeling. Sort of like your family knows what's going on with you, same with here. So the people that are close to them can kind of tell, and we can kind of gauge yes or no's are accurate.
How did you teach them yes or no?
Honestly, that started when they were very young, through ABA. That started all the way back in elementary school, giving them, you know, a picture or a word saying yes or no, and being able to point to it. And that's just something that's pretty consistent throughout their entire lives.
Please explain sensory regulation.
Sensory regulation. So sensory regulation basically is sensory processing information to plan and perform appropriate behaviors, provide a foundation for learning, which is so important from the early years. Um, you use that really in the early development. For example, like infants manifest differences for their strategies used for sensory regulation, but the boys, where noise, like for example, for the boys, if there's a lot of stuff going around them, too many people, too much sound, um, the environment, if it's just too much for them, for example, what we do to help them regulate is we give them the earphones that are noise canceling, and they can wear those as long as they need them. They have the choice to take them off. But for example, when we go to Disney World, they wear them almost the entire time because that's a lot of stuff happening at one time. So that is how we help regulate them. But again, we know them. So sometimes if all sitting in the living room and people are talking, Alex is going to let you know if he's annoyed at you. There's too much stuff happening. So he'll verbalize it. He might stand up. He just has a way of letting us know there's too much happening within his world.
Cerebral palsy is known as a motor disability, but sensory
Mhm.
should be talked about too. In
I
order to
agree.
do motor skills, I have to process it from a sensory perspective first. Even though I have gained good head and neck control, I still don't like hoods or hoodies. It doesn't happen as often now, but sometimes when people brush my hair, my neck is sensitive. I
Oh,
also have
yeah.
a more exaggerated
I can
reflex.
see that. Yeah. It's funny because, I mean, we talk about anybody with a disability and the sensory regulation, but even neurotypicals have it, right? There's we all have it, and to a degree, we can process it and figure it out better without outside help. But yeah, I agree.
How has occupational therapy helped?
Um, well, they were in occupational therapy since birth to 3. Elementary school was a had that was a huge portion of their day, which included OT, to help with, like, spatial awareness, texture avoidance, that is a big one for Alex, fine motor skills, eating, oral issues, mouthing issues, putting everything in your mouth. Both boys did that. OT stayed as a part of their education as they aged out, but as they got older, it was more consulting within, like, middle school and high school. They both received OT during, the early days of horseback riding too.
Occupational therapists have helped me explore and work towards independence and fine motor skills, including self care, leisure, and feeding. I consider myself left handed for signing, driving my wheelchair, holding a pen, etc., because it's my stronger, less affected hand.
Mhm.
However, I prefer to hold my cup or use a computer joystick on my right side.
Okay.
While my hands were small, I used the normal joystick, but as my hands grew, I now use the small ball instead for my computer, but not for my wheelchair.
Okay. So you're very similar to Alex and Chris because they're both ambidextrous. They both of them eat with their right and their left, but they each have one that they prefer, which is interesting because they have the ability to do something with both their hands, which if you're righty or left, you don't really always have that ability, especially a right-hand person. But yeah, that's interesting. I didn't realize that. I mean, I always knew that you always signed with your left, but I didn't realize that you did both. That's amazing, actually.
No. Oh, I can't sign with a weaker hand.
Mhm.
No.
And I
Oh,
wouldn't even know if Alex and Chris had a weaker
I do.
you too. Yeah.
The boys have a limited diet due to sensory issues.
When you asked me this question, I thought it was so funny. When they were younger, it posed such a problem. But as they've gotten older, their diet has varied and it's increased quite a bit. Some textures and colors are still an issue. But it's much better. I remember when they were in middle school and high school, there was a push for them to try new foods because I was always making their dinner the night before and then packing it and having to put it in the microwave because they didn't eat sandwiches or typical school food, or lunch food. So I would always buy, make something from the dinner before. But once they got to high school, I remember the principal at the time was like, "No, we should really get them to try like hot lunch every day." I'm like, "They're not going to like it." But it helped them to increase. And I remember one of the paras for Christopher, and she's gonna know who she is because we both know her, but I won't mention her name. She really pushed Christopher into eating a lot more, which was great. I was happy. But since Ava's been living with us, and she's been married to Zachary, she gets Christopher to eat the most amazing things, things I never imagined he would. So his palate has even grown the last 2 or 3 years even more. Alex is still kinda limited, but it's still better than it was years ago. I used to have to make, like, 3 or 4 different dinners every night. Now I'm pretty much down to 1. Sometimes 2, it depends, but
How do you know why they are avoiding food?
It's just experience, honestly. Again, when they were younger, it was, I think, a visual and a texture thing. But now that they're older, we do get them to, if they don't want to try something, they at least have to like touch it or put it up against their lips.
Mm.
Ava's very, very good about getting them to at least touch it so they know what it feels like. So that's kind of how we know.
Why do you think her?
You know, we ask that question a lot of ourselves. I will say that this is kind of a personal thought that I've always had. There's always been people in the boys' lives that just naturally are good and reading them and working with them. And it wasn't
Mm.
a job to them, it was more of a calling. And when we first met Ava, she was never intimidated by the autism. She never thought it was a novelty because in the past, some people do think it's a novelty to like, oh, I know somebody with autism. She just jumped in pretty much immediately, and that was during COVID. So there was a lot of downtime here at the house. And she just watched, observed, and naturally knew what to say, how to say it, how to be around them. She was never nervous or afraid. She just did it.
Mm. Like me at times.
Mm,
Oh.
exactly. Yep. Yep.
What is the difference between a meltdown and tantrum?
Well, yeah, that's different. There is a key difference though, between a tantrum and a meltdown, and that a tantrum is a choice. It's aimed to reach a goal, and you can stop them by giving that person what they want, or a tactile responder responds differently. But while a meltdown is an involuntary response to a stimuli. So a person with autism can experience both tantrums and meltdowns, and it does happen here. So it's essential to understand the cause and the symptom. So meltdowns are often more severe and emotional, more long lasting, more difficult to handle than a tantrum. Tantrums often happen with younger children. As children grow, the tantrums lesser and lesser in frequency, correct? So, however, like an autistic meltdown, there aren't age relation. There's no age related. It can happen as an adult at any age. And to be perfectly honest, Christopher still has those. So it's, and when it happens in public, people are like, they look at us like, he's an adult. Why is he doing that? When they're little, and a child with autism has a meltdown or or a tantrum, you can kind of guide people's eyes away from it. But when it's an adult, it makes it a little bit harder.
How do you consider the cause of a meltdown or tantrum?
Well, again, I think it really goes back to experience. Your surroundings, what is happening within that child or that adult's environment. Is there a medical need behind that tantrum or meltdown? But it really is, it goes back to a lot of stuff we were talking about before, like
Mm.
watching them, observing them, knowing the occurrences when it happens. It all blends together, but it really is about experience.
When and how do you help them?
It depends on where we are and what's happening. If you're in public, it's a tantrum. We just try to talk them about age appropriateness, tell them to stop their behavior. It usually is Christopher, not Alex in public. If it's a meltdown and we're in public, which can happen with either of them, we try to find a safe space to work through the meltdown, talk softly to them, use their headphones if we're in public. We talk about deep breathing. We help them we give that example of deep breathing. If at all possible, if we had like a weighted vest or a weighted blanket with us, we would use that. If not, we'll give them deep pressure with our own hands. Um, Having a place for them to work through it is probably the most important. Getting them out of that environment, even if it's within the same building, finding a quiet corner, walk if you're near an exit, walk out and, get out in the fresh air, things like that. It will all change if it's at home though. At home, tantrums are talked about and they're given timeouts. Again, this is mostly Christopher. He's the one who will have a tantrum. Meltdowns they both can have. So we use their bedrooms as their safe space. So we'll, use their blankets, their weighted blankets. We'll put music on for them if they need it. Their earphones, they have earphones with music and then the noise canceling ones. We always talk softly to them. A lot of times they just need to collect themselves. So if we're talking softly to them and we're not like our voices aren't elevated, it does help them.
If meltdowns lead to bedroom is.
Repeat that, honey.
If meltdowns lead to bedroom is bedtime harder.
No, not really, as long as they don't fall asleep. Because if they sleep during the day, then nighttime is harder. But no, I think we've created their bedrooms as a space that are very geared towards each of their personalities. So giving them that time, that, just quiet time, it doesn't really affect their nighttime. No,
They don't associate.
no, they don't. Absolutely no. Mm-mm.
Would one trigger the other one to meltdown or tantrum?
So this is one of the funniest things that I'm so glad I could tell you, and we've talked about this a little bit. Usually the exact opposite. They totally enjoy the other one's distress and sometimes even laugh at each other. Yeah. So it's not a normal response. Like if one of them's distressed, we all feel a little stressed within ourselves. Nope, they just laugh at each other.
No. Why?
No, I think we've talked about this within the family. I think it's a natural typical response to your sibling. If one's getting in trouble, the other one's like, "Ha ha." Uh-huh. Yep. That's what we've all come to the conclusion of. It's a typical response.
Are the boys routine? I know
Yeah.
they do appointments together. If one can't go, do you?
Yeah, the boys do have basic routines, but it's not rigid, not like when they were younger. Some events within their day do have a schedule that they follow. It's a little bit more formal, but everyday life is not like that here. We have morning routines just like everybody else, but they have in-home day services and ABA services 5 days a week, so their days are filled. And then, of course, their mealtime is pretty routine. Their bedtime routine is a little bit more formal, because you have to brush your teeth and, you know, do all that kind of stuff, take your medication. So that's a little bit more formal. But as for like appointments, sometimes they go together. For example, the dentists and doctors, but not every time. And one of the questions you had asked me is like, if we don't need to cancel for the other one, we will try to go, but there's a big difference when it's riding therapy. If one misses it, the other one can't go. because then the other one knows it. That's the one thing that I have to cancel if the other one can't make it.
Is it better either way?
Um, it all depends on the it it depends on the environment, it depends on their personalities of the day. Sometimes it probably would be better if we separated them, but sometimes just, like, having each other there, I think it's more of a support system for themselves, and they could show each other what's happening too, that helps.
How do you make that call?
It all goes back to experience. I know it sounds like I'm keeping repeating myself, but that's what it is. When they were younger, I wouldn't have been able to make that call easily. But now it's just matter of knowing them. You know, having Alex 29 years, you kind of get to know their personalities pretty well.
How many people do you take to be successful?
It depends. Typically, if it's both boys, it's typically 2 to 3 people. But if it's a new experience, like a new doctor or a new dentist or just a brand new place, we might bring 4 people. Yeah.
Mm.
Like, they're going to a new dentist at the end of May. We put their appointments together, so we will take it 3 people that day.
How has applied behavioral analysis therapy helped?
So, ABA helped always builds on the basic skills to teach for more complicated skills. The boys have always added programs to help them become more independent within their home environment. ABA can break down each skill and teach it step by step. We found that our sons learn a new skill better through the methods of ABA, like showering, doing laundry, dressing, even making brownies like he was doing Chris was doing that yesterday. You break down those skills. ABA can be a little controversy for some families, and I understand that, but we found it was quite helpful with our boys during their early years, all the way through high school and now as adults. They still have a home-based ABA program.
Better than occupational therapy?
Um, no, I think occupational therapy was absolutely necessary, and it's useful. And to this day, I think they could probably still use occupational therapy, but I don't think one therapy is more important than the other.
What is the difference?
You mean with ABA versus OT? I mean, I mean, OT is more about like for us, like fine motor, like learning how to hold a pencil for them when they were learning how to feed themselves, holding their spoon and knife and fork correctly, even drinking out of a regular cup. They didn't drink out of a regular cup until the last few years. They've always had, when they were younger, they had sippy cups, and then as they got older, they used water bottles with like straws like this. Um, but now they've learned to control their mouth to use a regular cup. So that's basically OT. But OT helped them even with like balance. I mean, that's a little bit more PT, but I think it all intertwines. But when you're talking about ABA, it's more about, let me give a good example. Learning to wash, take a shower. We would when we first started teaching them how to do a shower by themselves, which technically they can't. They still do need help, but you teach a skill like, wash your arms, but you're not going to teach that person how to wash their entire body. You're just going to start with your hands. And once they've mastered that skill, then you move on to an arm. You might have a schedule in the shower, which we did for a while. But that, I think, again, that all incorporates almost every therapy that they use. ABA, like at the beginning, it was a matter of having a picture and picking out the right object. That's how basic it is. So when they were little boys, they might have had like three pictures in front of them, and one was a block, one was a pencil, and one was a candy. They had to match the picture to the item. That's how basic it can be. And it can be just one picture and one item at a time. But all those skills from when they were little built. So now their basic skills are a little bit more complicated, but they're still basic to them. And then they can do more and more into their skill level can get higher and higher that way. And they can learn to do a little bit more independent things. Does that explain what I was trying to say?
I mean, because occupational therapy is also about daily living skills.
Yeah, that's 100% true. So again, I think for me, they just interact and they kind of blend. So I don't think one is better than the other for somebody with level 3 autism. I think that they both have great value and they intertwine.
You use visual schedules, social stories, picture exchange system, etc.
Yeah, so just like what I was just saying a few minutes ago about their showering, it was a visual schedule. I believe that they started that when they were in middle school, and we brought it home. They always had a copy for home, so it was literally what they were doing next. It was like a flip, and it was waterproof, obviously, because it was for the shower. But for me, that's a visual schedule. So yes, sometimes they use visual schedules, especially for something that has multiple steps, and eventually you can take that away and just maybe verbally prompt them or visually prompt them. Some exactly, touch exactly. So yes, to answer your question, is visual schedules and have been used in their past. Social stories have been helpful when they were younger. But if there's a new event or new environment that they're going to be coming into their lives, we may put together a social story just so they know um, what's happening. So it's nothing's a surprise. They have a visualness of what is going to happen next. Funny thing about that is when they were little, and we love to go to Disney World, but we used to make a social story up for every trip that we did. So we would put it in a notebook, and every day there was a schedule of what park we were going to, what rides we were going to. And I actually still do that sometimes for them, just so they're not because there's some new rides at Disney World, and if we haven't been on them yet, we may say, "Hey, we're gonna try this one." So we'd still kinda use the concept of it. As for picture exchange, which is PEX, Alex hates it. Lord, that he's never been able to, like he never liked it. They could use it with him, but he didn't like it. Chris will use it, but he would rather not. He'd rather not try to communicate that way. We try to give Chris signs and gestures to try and use. And then we also still try to use the iPad. Again, he kind of doesn't want to use the iPad. We know he can use the iPad. Alex, we try to use definitely more signs, gestures, but we also use the voice that he does have, and we ask him more yes or no questions. So we try to give Alex his voice more than anything.
I hate pictures on Proloco or Tugo. I deleted them.
See? Yeah. I mean, I remember there was a time when they were younger, like you would go into their classroom and there was a picture on every item, and that was fine within the school realm, but we tried to do that at home, and Alex would just rip them off and take the Velcro off of everything. So it never really worked in our home. And he didn't like the PEX booklet either. He would throw it out the window.
How do the boys communicate?
With some signing, some gesturing, some pointing. Alex is very has very limited vocal skills. He did talk when he was younger a few times. There were times in his world he had full verbiage, and then he would lose it quite often. But because he does have some vocal skills, he can use it at times. Again, yes or no are very, very important to him. It helps him to communicate the best way. Christopher sometimes brings us to what he wants or needs. He will physically come get you, pull you where he wants to go. Sometimes he'll use his iPad. It all depends on his mood. And some pictures. He still, if we have a schedule board or things like that, he will use those.
I primarily communicate through sign language and technology like an augmentative and alternative communication device. With immediate family and others that know my ways of communication well, I fingerspell, verbalize some letters and words, and use body language.
Yes, you do. I can remember when you guys were younger and you would yell at Christopher in sign language. You were the only one really that he would listen to anyway, so
Always.
yes.
What can Alex and Chris communicate?
Really, again, I'll say it again, it's the yes, no answers, questions and answers. But he will let us know when he's hungry. You can tell by the way he's acting or presenting. Sometimes he'll go get food to show you that he's hungry. He has been able to communicate when he's tired. It's his body that tells us. Pretty much like most little kids, you know when they're tired. Christopher does a lot of words around food. I mean, he is motivated by food. He when he wants a shower, when he wants a break, when he wants to go outside on the trampoline or in the pool, he will let us know in his way. So it's either signing or gesturing or pulling us to where or what he needs. But sometimes food, like if he wants cheese, he will go get the item and tell you to cut it.
The shower is interesting, so he feels dirty.
I don't know. It's interesting you're bringing this up. We just had a conversation yesterday morning about this with his ABA therapist. What we found is it's not necessarily about him like feeling dirty. It's more about I think he likes the feeling of the shower on his body. and it's kind of like I can go in there, I can relax, sort of like when some people like to take a bath. I think it's a self-soothing thing for him. So he will do multiple bath showers a day, sometimes up to 4.
Do you limit?
No, we don't. Nope. And even now, Alex is starting to like showers a lot more. So we'll do the function of a shower, but then he might stay in it for like another hour. So I think he's enjoying the pressure and the warmth of the water.
Would he use it for avoiding task?
How did say? Can you repeat that, honey? I got the last part.
Would he uses it for avoiding task?
Um. Oh, that's a good question. You know what? I would actually have to ask his ABA therapist because that he might be doing that. Yeah, that's yeah. I'll ask Margaret one day. That's a good question. I never thought of it that. It could be avoidance. Yep.
How do you make sure that they are listening, processing, and understanding what you are saying?
Um, if we feel that they're not really listening, we just call their names before we speak to them. Like we might ask them something or tell them something and we're not sure. So we'll repeat it by, saying their name, making sure that they look at us. Sometimes we repeat questions or statements. And sometimes we sign while we're verbalizing. So, for example, if we want them to get their socks and shoes on, we might actually sign socks and shoes. So I think sometimes verbally and signing helps in a like a 2-step or a 3-step process if they need to do something.
Do they ever get annoyed with too much?
Yes. Yeah, definitely. I think they both get annoyed equally as much, but in different occurrences. So they get annoyed with different things. I guess that's what I'm trying to say. They let you know. They will vocalize, or Chris might walk out of the room, or Alex might yell at you, but they let you know when they're annoyed.
How do you balance?
How do I balance that? Well, I think it's how do I balance that? I guess you have to think about it in the terms of like a neurotypical person. Like sometimes they get annoyed with people demanding of them or asking them. So sometimes you just have to walk away and give them the time and space. There are times we absolutely do give them the choice. Um, like for example, if the kids want to, if their brother and sister-in-law want to take them for a walk or a hike, we always give them the choice to go or not go. So I think that's how we balance it. Sometimes there's things that they have to do, so we have to work through that, but there's always a choice.
I didn't know if it was different.
No, pretty much the same. Yeah.
How has speech therapy assisted the boys?
Um, Well, when they were like school age, they had direct speech therapy every week. So it helped them to learn how to read, learn how to sign, communicate to the best of their ability. But after school stopped and they went to adult daycare, um, who did not use signing, they didn't text with them, they didn't use communication devices. Unfortunately, they lost their ability to communicate as well as they had been. So there was a big digression, which was quite sad. Um, so we use like the home ABA to help them. Their tech comes in and we work on communication every day because that affects behaviors, right? So as a family, we do the same thing. We break it down and we try to communicate and teach them to use what they know or reteach them what they used to know. But we are looking for a speech pathologist who specializes in nonverbal communication. We want to add that to their daily or their weekly therapies. So we want them to be able to communicate more. And don't get me wrong, they are better since they left daycare, but there's still some deficits, and we feel it's important for them to be able to communicate. So we use our language a lot. We talk directly to them all the time. We're talking around them at all times. We're giving them as much speech the way we know how to do it, and I think that helps. We don't leave them out of communication. We don't. A lot of people with a lot of people will speak around an autistic person who's nonverbal like they're not there. That's something we never do. We talk directly to them. We include them. Even if they're not responding, we say, if we said something, we'll say, "Isn't that right, Alex?" Or, "Hey, Christopher, did you hear that?" We always want to make sure that they're a part of the conversation, and I think that helps them understand the words better too, and they understand the meanings of words.
Speech language pathologists have helped me with feeding and communication. The muscles we learn for feeding are the muscles we learn for speaking too.
Yep.
When I was younger, speech language pathologists helped me in finding ways to communicate functionally my needs, wants, and social greetings. They helped convey to other people that I understand everything and research the appropriate means to share my knowledge and ideas via communication to use in a variety of settings. They taught me feeding techniques to help me strengthen and shape my muscles to safely chew, swallow, and say words that would be clear to my listeners.
Isn't it nice that you and the boys have had the same speech pathologist all those years?
How do you determine what to continue to work on?
So this was one of those questions you and I went back and forth about, but it depends. That depends on what is going on with their ABA programs mostly. If they've mastered something, and we basically will take whatever they've mastered and put it into a maintenance program and incorporate into their daily lives. If their program isn't working, and that happens quite often, we stop it and we'll revisit it at another time. Um, we never give up on teaching them a skill, but sometimes a skill may not look like it would if we were doing it. So we have to adjust it to their needs and their skill levels with support. So we we look at their daily life and we say, is there something that we're not giving them? Um, can they communicate? And it usually happens once they've mastered a skill. Then we're trying to go to the next piece of something, and we realize, wait, they don't have that skill level. So that's kind of how we determine what's going to be happening next. But again, it's also what is going to help them in their daily life. What do they enjoy? How and what do they need to be more independent? So that's what we kind of focus on. Sometimes we try something way off, that doesn't necessarily have to be something within their day, that we try to see if they can get that skill. If it doesn't work, we back off.
Mhm.
And by the way, sometimes the ABA therapist wants to try something and I say no, like using the oven.
Mm. Mm.
Self-feeding isn't realistic for me.
Mm.
Yeah, exactly. Like for the boys, a lot of it has to do with, they can't use an oven. That's a dangerous thing. So we don't even teach them how to turn an oven on, because if you teach them that skill, then they're going to turn it on maybe in an inappropriate time or place. They may burn themselves if they open the oven. So we're very careful about things like that. I'm also very careful about like chemicals that clean. We in general have, very things that aren't horrible for the house, but you're going to use bleach at
Mm.
times, so we don't allow them anywhere near bleach.
Mm.
Anything that cleans the bathroom, we don't let them near. So we're very careful about stuff like that, but that makes sense because what if they knew how to pour it, then something happens and they could get burned. So those are the kind of things you think about. Like you said, like there's skills or things that can harm them. So we don't want to ever give them the opportunity.
How has therapeutic writing enriched your lives?
This is our favorite subject. Well, Little Britches has been a godsend to our family. At the beginning, it was about connecting to being to other another being, like to a horse or other people, working on their core strength and balance, which was so important.
Mm.
So that was in conjunction with their OT and PT that we had at the program. um, but all these years later, it's about community. It's about building social skills, about being a part of an activity that is lifespan. We talk about that all the time, how important that is. Not a lot of programs are lifespan. Um,
Mm.
this program connects them to other people, and it's so joyful for them. They both love riding, and they look forward to it every week. I hate when it's bad weather. Exactly. And riding has been their favorite therapy their entire lives. I mean, they would do that every day if they could. Exactly. The three of you just need to ride every day. And think I don't know about how you feel about this, but I think it's also a comfort to them because it's a consistency that they've had, and it's interesting. A lot of people are like, "Oh, I would never go near a horse." Well, you guys were little when you started, so there wasn't a fear of horses. And people with autism technically don't have a lot of fear anyways. Some of them don't have any fear. I grew up with horses, so it was never anything to be afraid of. You have to respect that. Have to respect a horse. It's huge. But there's just a comfort in being on that horse. You can see their body language change when they're on the horse. There's a relaxation, and you can feel that they're feeling the horse, and I'm sure you feel the same way.
Riding reduces my high muscle tone and improves my balance, posture, gait, and stability.
Mhm.
Horseback riding stretches my muscles and reduces my spasticity.
See?
This allows my movements to be softer, quieter, and more accurate. As the horse moves, I am constantly thrown off balance, requiring my muscles to contract and relax in an attempt to rebalance.
Yeah.
Riding requires me to coordinate numerous muscle groups to work together to get the horse to start, stop, turn, and bend in the direction we are traveling.
Mhm.
And the horse provides constant feedback for me to react to, which in turn improves my motor planning. Stopping and starting the horse, changing speed and changing direction engage my core muscles.
Yeah.
Increased core muscle strength directly impacts posture, head and trunk stability, which allows me to be as independent as possible. All these benefits help me physically and emotionally get through the day and week and reduce the constant tug of war I have with my own body. This makes participating in daily activities exponentially easier for me.
It's pretty amazing, isn't it? It
Mm.
just actually it makes me wanna cry because it's everything you said is so accurate. Even when they were little, they didn't have a good core strength, and that's what we worked on, right? So now they can sit up, um,
Yeah.
and you and I know that the movement of the horse is just like the movement of a typical body, so that helps your core strength. Yeah, it's a pretty amazing thing. I know that there are times when the boys are very stressed and they get there and they get on the ponies and they you can see them just relax. I think it balances them too.
And sensory integration isn't talked about.
Mm.
That's true. Yeah. Yeah. Totally sensory integration, right? I mean, there's nothing yeah, I agree. Mhm.
Are the boys on medication?
Yeah, they currently are, but through the years, they've been on different medications. They both tried Lexapro, no effect on Christopher. Bad or good, didn't affect him. Alex, unfortunately, after a while, it gave him facial tics, so we had to take him off of that. Alex tried risperidone. He gained 40 pounds in 2 months. It was so unhealthy for him. Um, he also Alex also had to be put on Klonopin, which uh, it's a pretty strong drug. It almost makes him comatose at times. We had to do that during a really dark period in his life where he was behaviorally hurting himself and hurting others. We used it, in emergencies, not in everyday medication, but when he took it, he would be out for hours and it would take him days to get back to his normal self. Currently, and in the past, we've also used like CBD oil on the boys, but it didn't really make a difference for them. We didn't see any differences in behaviors or anything like that. But currently, Alex is on medical THC. Um, we find it's the quote unquote best medication for Alex. It has no side effects and it helps with his aggression and his anxiety. He's been on that for about 3 or 4 years now. We find we like that it's a natural thing, so it helps him, and he doesn't have the facial tics or more aggression, so that's a good thing for him. Seroquel is what they both take to sleep at night. They take probiotics, they take a vitamin B, they take multivitamins, things like that. But Seroquel, it's interesting because people with autism, a lot of them aren't great sleepers. You can give them medication, they still not gonna sleep. You and I have talked about this in the past that when Alex was 15, there was 9 days straight that he stayed up, um, over the summer, and that was tough. But people with autism tend to sometimes not sleep. They can go a day, a couple of days without sleeping. And it's not that they're not tired because they are, they just can't shut their brain down. So we give them the Seroquel just to relax them, hopefully have a good night's sleep. Doesn't always happen, but it's better than when they weren't on it.
Was trying medicine a hard decision?
Mhm. Yes and no. At the beginning, we were like, we're not putting them on anything. And then we realized you sometimes need something to adjust what's ever going on within your brain. But we didn't always agree on what we were doing within the house when it came to medication, but we were willing to try, and we had a really good doctor behind us. But we're all glad that Alex isn't on a lot of, chemically based medications. We just find for him it was too harsh for him. We're happy that he's on the THC.
I'm only on seizure medication. It took several medications to find the correct combination for me. but I was on Keppra 3 times a day with clonazepam also taken at bedtime.
Mhm.
As a sophomore, I successfully weaned off Keppra. We luckily only saw a temporary increase in my high muscle tone while weaning off, without adding medication for spasticity. Because I was on this medication for most of my life, we noticed that I had Keppra rage, which made me irritable. We added a probiotic after Miralax didn't work, and recently started vitamin D supplement. I would
Mhm.
use iron pills due to recent discovery of anemia. However, they've infusions instead as they work effectively without digestive problems.
Yeah.
Those infusions were effective for me as confirmed by recent blood work. I will have another recheck in a few months and so forth.
I was just thinking about something because you were saying that you're doing some like D supplements. We put both boys, they're on probiotics for the, stomach issues, but we increased their vitamin B12. That's also a vitamin we found that's pretty good for stomach issues. I take it too. It's just something you might want to talk over with your doctor is a supplement more of a B12.
Have you and Tom always agreed on this big balance of behavior, communication, and medication?
Yeah, my answer is about 99% of the time, yes, we agree. In the past, if we didn't agree though, we never discussed it. Like if we were at an IEP meeting and there was something that we didn't agree upon, we always were a united front. And we're like that for pretty much everything that we do with them. Now we have Zachary and Ava who are a part of the decision making for the boys. So we work it through all, we'll have a family meeting if something's not working. We talk about it and we try to agree on how we're going to approach whatever it is. Because in the end, Tom and I aren't going to be here forever. So Ava and Zach are probably going to be the ones to make all those decisions. So we wanted them as involved as they wanted to, and they are involved 100%. So every decision, medication, therapy, what they're doing during the day, anything, behaviors, we talk about it.
In the beginning, were any of your views different than today?
Yeah, that's another interesting question when you ask me that. In general, my views are pretty consistent through the boys' growth. I mean, I don't really change much. There have been specific situations or concerns that we've had to adapt to, but I feel like I've always been consistent with their advocacy. I had good relationships with the staff that worked with them. If there was a conflict, you know, I didn't let it fester. I would take the proper steps to resolve the conflict or work through it. I did that um, from the time that they were diagnosed, and I still do that. The locations or the situations doesn't change my views when advocating for them. So there is one view that I feel that changed a little bit, but it was the right one for the boys. So we want them to always be happy in their lives. That is our goal for the boys in every aspect. But we still have them work every day on improving their skill levels. But there is not as much worry about that as when they were little, like keeping up with others their own age or the same diagnosis, there was always this thought in the back of my head that they had to keep up with that person who is at their age or at their skill level. And I think it was kind of a driving force for most people who worked with people that young. But now we don't feel that way. We just want them to be happy, content within their lives and to the best of their ability, do the skills that they can do. And we will be there to support them.
Did you have any knowledge of special needs before?
So I do have a family member who had Down syndrome, but I didn't live near him. But physical disabilities, yes. my father has some physical disabilities, so I grew up in a home like that. But when it came to neurological disorders, no. I mean, I knew people with Down syndrome. I've heard about autism at the time, but again, that was when the occurrence rate was 1 in 10,000 people. So autism was kind of set aside. Um, when it was kind of implied that there was a possibility, I did as much research as I could.
Did you have issues with providers who agree on your preferences and concern?
Yeah. It's a good one, right, Kay? Um, we have been fortunate that we found a psychiatrist who worked with us since the beginning. He's still with us 26 years later. Um, he always talks about their diagnosis with us, their behaviors, all the medications that are on the market, any side effects. He wanted to know our opinion, and he would always encourage us to express our concerns, which that's the only way for us to work with a doctor. We have to be able to say what we need to say. He would listen, and if we heard of a new medication that was on the market, we would talk about it. What's the pros and cons? What kind of research was done on it? Um, we've had to change our pediatrician 3 times when they were both under the age of 7. Some were because of rudeness. Others were aggressive towards the boys. There was an example of one time Alex was about 3 and Christopher was about 1. I was holding Chris in my hand and the doctor wanted to examine Alex. He was behind me and he reached behind me and grabbed Alex. That's just not something that we agreed. I pretty much walked out of the office at that point. I had one doctor before Alex was diagnosed, I had went into the pediatrician's office and said, I have a concern that, he's not sitting up. He hasn't started walking. There's no type of communication. I knew there was something going on. And he told me point blank, I am a hysterical first time mother and that I didn't know what I was talking about. Well, I told that doctor what I thought about him and I walked out. It wasn't the nicest words, but that's okay. We finally did find a pediatrician who she actually was a former special ed teacher and became a pediatrician. So she had a lot of knowledge and understanding. So we had her until the boys aged out, which was great. Um, we're pretty much, we feel that if a doctor doesn't want to have a conversation with mom and dad or that people who are bringing them to a doctor's office, then we don't feel comfortable and we won't go back there. Um, it was funny because when we were having this conversation, just on Monday, I had taken Christopher to the eye doctor. And 3 days before the appointment, I called ahead to remind them of his needs and what we were going there for. So they were prepared for him because eye doctors, where we go, is very busy. There's a lot going on, there's a lot of people. And I just wanted them to remember because we only see him once a year. This is the kind of needs. And they refused. It was not a good situation. They didn't even know that I called. The nurse was kind of aggressive. And on top of it, as you know, I have a foot issue. So I was on a little scooter. I couldn't move around the office very well. So it was kind of a tense situation. Finally, one of the nurses recognized us and brought us into the right room. And she brought the doctor to Chris, not the other way around, which worked out better for us. There have been times like that. We've been fortunate, knock on wood, that the few times we've had to take the boys to the emergency room, we've been lucky. We haven't had a negative experience at a hospital, an emergency room. I am, you know me, I will go up to whoever and say, this is their needs. This is what we need. If you can't provide that, I'm walking out. So always advocating, never not advocating. And I've learned really early in their development and their lives that I will say no or no way to any professional if I don't think that they're the right person for my boys.
My pediatrician was great. He performed CPR to give me my first breath of air, and on August 11th, 2020, I still remember him saying at our last appointment something like, okay, I didn't know that you could cry. However, one time before college, I couldn't get in with him and I had to see one of the other doctors less familiar with my history. I had an earache. He was rude, said my ears looked fine, and she can't explain herself. I left there crying because of his actions and my pain. He finally looked at my chart and saw that I had TMJ. He recommended that I go see my dentist, and yes, it ended up being a TMJ flare. Everyone, especially the medical assistant at that dentist's office, was awesome.
Good.
One time when I was going to get molded for a mouth guard, she told us that she would have come to the car and done it. However,
Oh.
we already made our way in, I believe. We haven't had any issues with my internal medicine provider, and she agreed to doing annual blood work for me without really any discussion about it.
Good.
I remember Mom saying that one neurologist lost me as a patient because they wanted her to drive to them with me seizing. I'm waiting for the appointment where my current neurologist determines it's time. Every time it gets brought up, he's fine keeping me. However, I keep asking our mutual friend if they got kicked out yet. My eye doctor has been awesome too.
Yeah, it's some very similar experiences, right? I mean, it's one of the biggest things you have to keep advocating, and thank God you have your mom and your family to be there for you to advocate. Even though you can verbally tell them the way you talk and the way you communicate, it's still nice to have somebody behind you and backing you up. To be honest with you, there's no reason for a doctor to be aggressive or rude. If they just did, if they just did a little bit of reading before they saw the patients, I think that would help.
Communication is still tricky.
Yes, it is, but what's nice, like I always find watching you, you if you have one of your family members, they know exactly what you're saying at all times. I think it's one of the most amazing things I've ever watched. So that's good that you always have somebody with you. I understand that. We can't even get the boys' blood work done. They don't allow that. They don't allow shots. They physically won't allow you to take blood or give shots. So if when we have to do that, they have to be sedated, and that's a whole nother thing when it comes to people like Alex and Chris.
How do you determine medication level?
Well, so that was kind of a problem when he was on the Klonopin, but because he didn't take it daily, we just kind of made sure we watched him. We had to report to the doctor on a tri-monthly basis instead of like every 6 months. But we didn't really have to worry about that. Most of their medications, you don't have to worry about levels, which is good. I mean, if it had been, we would probably have to sedate them 3 or 4 times a year, and that's not healthy.
No.
Exactly. Even like dental work, sometimes you have to sedate them. Yeah.
I would have to be.
Yep. I, I guess it's okay though. I mean, I guess I would rather go to the dentist and be sedated too. I don't want them to do anything.
Thank you, Melissa, for doing this with me. It was great to have you on. Please share this talk show with your family and friends. Everyone watching, don't forget to like, follow, subscribe, and share on Facebook. Instagram, and YouTube.